For
Okay, Walt.
Good afternoon, everybody. Welcome to the second webinar in our series on access to healthcare by people with developmental disabilities. If you were here 2 weeks ago, you know that we had a national researcher and a national author speak about some disturbing data about difficulties people with developmental disabilities have and people with disabilities in general have in accessing healthcare. Today we're going to focus on Connecticut. Okay, we have the University of Connecticut Center for Excellence in Developmental Disabilities here presenting some data on a survey they did of individuals in Connecticut on this issue. And then we're going to hear some stories of lived experience by individuals with developmental disabilities and their families here in Connecticut. So we're hoping that this will be informative and lead us to a better understanding of what needs to be done to improve access to healthcare in Connecticut for people with developmental disabilities. And I'll hand it over to the next speaker on the agenda.
Hi, my name is Mary Beth Bruder, and I currently direct the University of Connecticut's Center on Excellence in Developmental Disabilities Education, Research and Training. We are one of 67 such centers across the country, and most of our work is done on behalf and with people with disabilities. This area of healthcare access has been one of our primary areas for as long as I've been director of the UCED and since I got into Connecticut and I met Molly Cole, who was instrumental in working on the Katie Beckett waiver, which was the first time I had a chance to really see how inaccessible supports and services were for those with disabilities. Since then, Molly and I have worked together on a number of pediatric initiatives and a number of trainings, including the first medical home project. But I'm here to say how honored we are to be part of this initiative with the Connecticut Health Policy Project and also the Connecticut, our sister agency, Connecticut Developmental Disabilities, and to share with you that we have been looking at access to healthcare and also educational needs of healthcare providers for about 30 years. And I'm very happy that we have data that just justifies and also validates some of the issues that you heard last week and will hear for the next number of sessions. I'm going to be turning this over to Dr. Tara Lutz, who's the coordinator of healthcare promotion in the Connecticut UCED.
Tara, we can't hear you.
I would do that. Apologies, everyone. But this is Tara Lutz speaking. I'm going to talk about the most recent survey that the UCED has conducted, healthcare barriers for adults with disabilities in Connecticut. And I'm going to look at some of our findings. So this first slide talks about attitudes. We had 87 individuals with disabilities participate in our 25-question survey. 39% of these individuals indicated that their healthcare providers have shown negative attitudes towards them. Some specific examples included being treated as inferior, providers using offensive or outdated terminology, providers not addressing the person with disability directly, and providers not listening or being dismissive of persons with disabilities. Other needs from our survey are the need for accessible office office spaces and equipment, the need for support to use telehealth, support to make and keep appointments, and issues related to insurance coverage and cost. And I apologize, I'm going to move backwards. I advanced too quickly. We'll talk about some of our communication findings. Almost half of our survey sample reported having issues communicating with their healthcare providers. Sometimes this communication issue was related to providers not understanding the medical concerns of the person with disability at the appointment. In other instances, this was a person with disability not understanding the instructions from the provider in terms of what to do next and what the next steps were. For the group within our sample who utilized a mobility device, sometimes these communication issues related to not knowing why someone was staying in a wheelchair, for instance, instead of transferring for a particular medical or dental procedure. Finally, we asked our participants about what they thought their providers and healthcare staff needed in terms of training. 61% reported that they didn't think that their provider and staff had training about the needs of persons with disabilities in healthcare. 65% reported that they should have this type of training, and for multiple reasons, including the following. Healthcare provider and staff training to meet the needs of persons with disabilities would allow them to provide better and more comprehensive care, help them be better providers in general, and to help ensure that persons with disabilities are treated as equals. As we transition to our panel discussion, it is important to note that Molly Cole, who will be the moderator for the panel, and the Cross Disability Lifespan Alliance worked closely with the USAID and LEND to help us develop a survey instrument that was accessible for persons with disabilities to complete in terms of language and terminology used. And with that, there's our transition slide. Thank you.
Sorry, sometimes the click doesn't work. I'm Molly Cole, and I am the Executive Director of the Connecticut State Independent Living Council. And I'm absolutely delighted to be part of this process, and really, really, really happy that the DD Council has taken this on as an initiative. I think it's highly needed and something that we really need to discuss more. It's healthcare access for people with disabilities has been an issue for as long as I can remember. So I'm absolutely thrilled that you have a great panel this afternoon, and I'm not going to spend a ton of time introducing them, only to say that we have 4 people with varying views on access to healthcare and varying challenges that they have experienced in all areas of access. And that would include a lot of what Tara just outlined in her survey. Attitude access, accessibility issues, the issues of telehealth versus community care, just in general communication and instruction, and a whole realm of other issues relating to access that I'm sure they can explain well. So I'm going to do a very brief introduction of the 4 panelists, and then as they are speaking, in the order that they're speaking, they're going to tell you kind of what brings them to this panel as they talk about healthcare access. I would not presume to share that information on their behalf. I think it's more important that you hear it directly from them in the words and descriptions that they choose to use. So with that, I'm going to introduce the panel. We are taking questions in the Q&A, so Ellen, I assume you'll manage that as we go forward. First up will be Darlene Beret. Darlene is from West Hartford. She's a parent, and she will tell you more about her experiences. And then we have Donna Cohen, also a parent from Windsor. Marianne Colon, who is from East Hartford, and then Sandra Robinson, who is from New Haven. They all have very different experiences, and I think that will really enrich the conversation as we go forward. So with that, I'm going to turn it over to Darlene.
Thank you. Good afternoon. So my name is Darlene Beret. I have a son, Ben, who just turned 22. He has severe autism, which just means he can't talk or write or read. He has an iPad where he can request some of the things that are important to him. And only, I would say in the past 5 or 6 years, is he able to isolate if something's wrong with him, like a tooth, he can now point to it instead of just scream. So that's been some good improvement. But I can tell you, I just want to touch briefly on attitudes. Ben is 6'1" and 265 pounds. So he can be a little scary looking. And what I found with medical care is they're terrified of him. So when he had his first seizure, the ambulance came and they immediately sedated him. And then we go to the ER and then they sedated him again. And they sedated him so much that they ended up having to intubate and we got admitted to ICU over something that we probably didn't even need to call 911 on. And it was really because the people, as soon as they heard severe autism, you should have seen their faces. They looked terrified. I think they just had no idea what it was. They had no idea what happens when he wakes up. They wanted to do some tests. They wanted him to stay under, but they were just really, really nervous and they didn't know what to do. So I think more training would go miles. But it's just an example of you go in for something that's very simple and you end up in the ICU. One of the benefits to come out of 2020 for us definitely was telehealth. There's many appointments we would go to where Ben won't get out of the car. It's so hard for him to transition go to the hospital, go to this floor, go to that floor. And it was really impossible. And telehealth made everything work beautifully. And the doctors could see him in his own room, in his own house, doing what he does comfortably, or some issues that we'd have, when he does this. And so they could see it all and it made it easy. But I did want to just tell you a quick story about our vaccination experience. So he is injection averse, I guess you'd call it. So we can't get blood draw and shots or anything like that. So what we've managed to do is if he has to get a cavity filled, for example, he has to be put under completely to have a procedure like that done. And we'll contact all of our doctors and say, okay, let's do our blood draw now. Let's do this now. We get everything done at the same time. And so he was having that done. And so we asked if we could get the vaccination at the same time. And they said, no, we can't do that. We don't know what would happen. And I think importantly, there was no intention of doing any research at all ever in the future about, is this possible? Can we get a vaccination while he's out for a different procedure? So it's just something that would be great if people thought of things like that. So we ended up going to a hospital where they had a special area set up for people who were, sensitive, I guess. And it was nice. It was a room off to the side. They had squishy toys. So it was basically set up for little kids. I don't think they really had an understanding of big guys. So that didn't work. So then with the help of Walt and the Connecticut Council on Developmental Disability, they set up a special clinic. It was off to the side. It was not part of a hospital. They had trained personnel that were just dressed in street clothes, so it wasn't scary. There was a Disney movie playing if we wanted something like that. It's just, they really accommodated us, but he's a tough case. So it ended up, he would have to be restrained. Now, he's never been restrained. He's not aggressive towards anyone but himself. He has self-injurious behaviors. So, so it ended up, we asked them, is it possible to talk about the different restraints that are available? This is nothing you want to do. We were trying to start it off as the least invasive possible, but we really wanted to get this vaccination done for him. So they would allow it if we brought in our own people. So we worked with DDS and our case manager, and they actually showed us restraints on us. And my parents went too, because we are all in big support of my son. And they did the restraints on every single person there, and they showed them how. And the people that were going to do the restraints talked to us about why they got into this. They have relatives with disabilities, and they just had the biggest hearts. So instead of becoming a one flew over the cuckoo's nest kind of vision of what restraint can mean, instead it became really this team approach of, we're going to do it for a second, and then we're going to get the injection in, and then we're going to be high-fiving and hang out still and make sure it's a positive experience. And that's exactly what happened. And so it took a couple tries to do it, but it ended up working really because everybody was very, very flexible, and they really, really listened. So instead of saying, we're going to do it this way because this is the way we always do it, they were very open to try different things. And I think that was really, really helpful. So it's not your normal, let's just get in. I used to look at people walking into CVS, getting their vaccination and walking out. I was so jealous, but it's a little tougher. So one of the things we don't know in the health industry is severe autism. And when I try to figure out, is anyone researching this? Is anyone educating this? So I guess I'm really grateful for panels like this and opportunities like this to just share this type of information. That's my experience.
Thank you, darling. That was great. We're going to move right through the panel and then come back. If the audience has questions, that's great. Otherwise, I probably have a few as well. So we're going to move to Donna. Donna, go ahead.
Hi, so I'm Donna, and I have a daughter in her 30s, diagnosed with autism and an intellectual disability. And much of what Darlene said is our experience as well, though she can get pretty physical with other people if she's scared. She can bolt and run. And so her behaviors are dangerous, and she has not had a vaccination since I think she was 12 when they had to do them. And that was kind of it. We don't do blood work. Again, same thing with general anesthesia if she has any kind of dental work done and so forth. So our first experience with the clinic that they had for people with disabilities for the vaccination was amazing. And much of what Darlene already went into, so I don't want to repeat it, but I will say that we initially tried to do vaccinations at home. And the doctor who was running the clinic actually was here with an EMT, and that didn't work out. And then I also called the health department just kind of to feel them out on how much they were willing to be a little flexible. That wasn't going to work out. So we ended up saying, okay, let's try this. And we went, and it was amazing. It was such an amazingly good experience. It was very personalized. They had videos that she wanted to watch. They had rewards that she liked. They had snacks for her that she liked. It was just very positive. And in fact, they said, because I'm a very nervous person about things like this, and they said, if you want to go down the hall, you can. And I ran down the hall. I was perfectly happy to not stay there because I think I was making everyone nervous, including my daughter. So within 10 minutes, they came back down and said, she's all set. I was like, really? I was amazed. I was amazed. So it was a great experience. Now, fast forward about 4 months, and I got a call from her regular doctor that the Johnson, which was supposed to be a one and done kind of deal, it wasn't working out the way they expected it to. So we needed to do this again. However, the clinics were not available anymore. So I was in a bit of a panic. And again, I called the health department, just I thought maybe they've given it some thought. Maybe other people have done it in the last 4 months, apparently not. So that didn't work out. And so on my own, I still had the email of the doctor who ran the clinics, and I emailed him and said, "Hi, do you remember us? Can you do this again?" And he was willing to. And he said, don't call the office to make the appointment. We'll do it all through email. And then I called my caseworker and I said, I could possibly use 2 staff people again to come help us, and who are trained in physical management. And GDS was great. And we had the 2 people and off we went. So now, however, we're in like a regular doctor place. And what makes me very nervous about that, first of all, is that there's other people in the doctor place and they all have cell phones. And it really concerns me that we will someday become one of those YouTube sensations. I don't know ever what behavior my daughter's gonna come out with. And it can be scary, even though she's a girl. I know people are like, oh, she's a girl. She's pretty strong. And we just don't know. So that makes me nervous. And there was nothing we could do, though. This was it. So we got there, we met our staff. They said, oh, let us go in. We'll get all the paperwork for you. And we'll try and like get her in and get her out. And when they came back to the car, they said, the waiting room's pretty full. And the exam room is very small. And the last time they did this with her, she went down to the floor. Like that was her escape. And they were worried that if she went down to the floor, she would get hurt or somebody else would get hurt. But they said, the doctor said they would come out to do it in the car. And how kind is this? So I said, well, okay, now we have a DVD player. We're trying to figure out all the logistics of it because I wasn't prepared for this. But I have to say, they were very good. And as I saw the person coming with the syringe, I rolled down the window, and honestly, they were there and gone before I knew it. And they zipped on back, and lo and behold, there we are. We were vaccinated again. So on the positive side, it worked out. But what I really found, the difference between the first time we went, when everything was completely focused on my child, truly, and her true needs and what could make it work for her. The second time, it was more like shoving square pegs into round holes, It worked out, but it was iffy. The whole way was iffy. We didn't feel confident. And I think our daughter, to be honest, was confused. She was so perplexed. So the importance of having places that understand our children and actually celebrate when things, go well, and high five and say yay and say, here, have a cupcake. That's the kind of thing we need. And we need it for the individuals as well as the families. This is hugely stressful. I cannot tell you how many nights I did not sleep before we did both of them. So it is my hope that people will start to understand our community a little better as time goes on. And just quick side note, telehealth has been amazing for our family. Our daughter happens to be a skin picker. We often end up with infections. And so now, instead of schlepping in and doing the whole, it's always an ordeal when we go to the doctor. We can just go, oh, look, hey, here's her finger. Can you see it? Okay, great, antibiotic, thank you. And we're done. It's like literally 5 minutes and we're good to go. So I would really encourage health professionals, doctors, nurses, anyone in the health profession to consider maybe how that can be best used. So that's my story.
Thank you, Donna.
Thank you.
I have tons of questions for both of you at this point, but we're going to keep moving because next is Marianne Colon from East Hartford. Hi, Marianne.
Hi, Molly. I found the mute. Hi, my name is Mary Ann Colon. I live in East Hartford, Connecticut. I am the guardian of my brother, Raphael, who has developmental disabilities. He's my baby brother. But I also have a rare condition called primary antiphospholipid antibody syndrome, short for APS. Sorry to the ASL interpreter for that. So I'm going to talk a little bit about me and then a little bit about my brother. When it comes to having a rare condition like APS, APS is known as sticky blood syndrome, and it's damaging all my organ systems, and there is no cure. I take a lot of blood thinners, and the best part about APS is navigating health insurance. Accessibility for health insurance, coverage for health insurance, affordability of health insurance. When I first was diagnosed with APS and I started getting services for APS, I discovered that a lot of my health insurance costs that usually were covered were no longer covered, because under the insurance Connecticut, for instance, even though I just go for regular blood work, there are two lists. There's a list called for pre-existing conditions, and you hear politicians talk about it all the time. All pre-existing conditions are covered, and you think that you're covered too. But then they have a second list, and the second list is for rare diseases. And this rare disease list is only 200 rare diseases for Connecticut and Anthem. And of course, since I am the only primary APS person in the state of Connecticut, APS is not on the rare disease list. So I have to pay for anything that has to do with my antiphospholipid antibody syndrome diagnosis. And that has been a struggle for me. In 2015, I was fortunate to be part of a partners class, and we got to learn a lot about the legislative process, and we got to create an ask. And my ask was, why have these two lists? Why can't we just have coverage if we're paying for health insurance? The politicians that I spoke to that day were, I want to say they were really genuinely surprised at my ask. And they felt that it would be simple, that it should be a pre-existing condition and everyone would be covered. But if you see how many fundraisers there are for people with rare cancers that are not covered by their insurance, and rare disease that are not covered by their insurance, and these are people and family members that have to buy their insurance through the exchange, and the cost in the exchange is extremely high, and there's just no coverage because of the disparity and the hope that when they say pre-existing conditions, all pre-existing conditions are covered, that I am covered too. And it hasn't been that way. The one thing I can say positive about insurance is that telehealth is covered at 100%. So that's always great to have a telehealth visit, because I know I'm not going to have a copay. When it comes to my brother who has developmental disabilities, he is on Husky. He has Medicare, Medicaid, because he has work, and he navigates his life on a 2-year-old level, at his worst, at his best, 6 to 7 years old. He's a fantastic guy. But when it comes to doctors understanding how to speak to him, how to help him, it's always a struggle to see how much they don't know. I always have fun taking my brother to the dentist, because my brother has significant issues with dental damage, and it's because of abuse in his past. And every time we go in and they look at his x-rays, the dentists come in and they're like, oh, can we talk to you privately? And then I see them take my brother away, because I must be the abuser, because I'm the guardian. And they start questioning my brother, and he gets nervous and he gets scared. And then when they finally put us together and they figure out, hey, I had nothing to do with it. But every single time we go to the clinics that only take Medicaid or Medicare, it's always a big rotation of brand new doctors and nurses every single cycle that we go in, because of the fact that they don't pay much. And after these doctors are done doing their rotations, they leave off to better pastures. And then we have brand new students coming in, and there comes another person who's taking my brother into the room because they think I'm the abuser. And I am not the abuser. It'd be great if someone could just read his file and say, yes, he had significant damage. Yes, he had abuse in his past. Yes, I didn't fracture his jaw. That's an old fracture. You're looking at this x-ray and you're treating me like you're about to call 911 and arrest me. And my brother, again, is being traumatized at the hospital. So yeah, so that's my story in a nutshell. Thank you, Molly, for thinking of me when you have these great sessions. I know, I
How
know.
could I not think of you? It just happens. Thanks, Marianne.
Yes.
And now I want to turn it to Sandy Roberts. Sandy, you're on.
Hi, thank you so much for inviting me to be on this panel. I am actually the person with a disability, and I have a physical disability, which I've had since birth, called arthrogryposis. And it's interesting because even though I was like raised in the 70s, where you think there'd be a lot less knowledge about my disability, I was able to go to Newington Children's Hospital and be covered by a whole team of doctors who had full knowledge of the type of disability I had. So I was kind of in for a shock when I started going to doctors as an adult, because a lot of them that I met with had very little understanding of my disability, or had no understanding of my disability and how it affects my joints and my muscles. And, you know, you kind of go through this whole question and answer session every time you start with a new doctor. And I think because of that, a lot of times, like I had a knee replacement back in 2016. He was an excellent doctor, don't get me wrong, but I think I would have felt better if somebody on the staff who knew about arthrogryposis and had knowledge was there too, because after the surgery, my knee could bend all of a sudden. Prior to that, both my knees were stiff, but allowed me to stand and walk. So now I have this one leg that just collapses, and I have the other leg. So now I'm basically can chair at all times, where before at least I could transfer and everything else. So, you know, that's been difficult to deal with. And also I just went through a whole ordeal with Medicaid. I've been on Medicaid for the employee disabled since it came into existence. And that program pays for my personal care assistance. And you keep running into caseworkers who have no idea what the program is. I went through this whole ordeal in September, and I'm still trying to straighten out where I have to pay monthly premiums based on my income. So I pay monthly premiums, and I paid by August 30th, I had paid for July and August, but they immediately took me off Medicaid, and I was trying to get back on Medicaid, and there was all this confusion. They found my payment. Then in the end, I finally had a good caseworker, and she studied it. They're like, but you still owe for May and June, even though I got bills for zero at that time. So then I had to rush and express mail a payment for May and June. And I kept telling them, you know, then I finally worked things out, and they tell me, oh, you're going back retroactive back to September 1st. I said, great. I'm still calling. They still have my Medicaid ending as of August 31st. And my aides got letters saying they were going to be no longer getting paid by Allied after the 27th. I got a letter, you know, so it's very stressful. And, you know, it's just like, it'd be so good if everybody worked together. And just to briefly mention, I go through ordeals like with Hoyer lifts because I'm a Hoyer lift transfer, trying to make sure Hoyer lift is there, present at the exam if I have to get out of my wheelchair. And then people not knowing how to work the Hoyer lift once you get there. A few times I try to explain to my left leg doesn't bend, my right does, but my left doesn't. And they practically break your leg trying to use the Hoyer lift. So yes, I've been through some very stressful examinations and things like that. In some regards, telehealth is good, but in some regards, telehealth is bad because sometimes they'll want to do a telehealth appointment. I'm like, okay, how are you going to take my blood pressure? Who's going to listen to my heart, through a computer screen, So I see a lot of good things out there, but I also see a lot of negative things going on. So it's very much a challenge at all times.
Indeed, it is. Thank you, Sandy. Ellen, before I go on to their questions, are there any questions from the audience?
No, there aren't. And we should remind people that they can click the Q&A button at the bottom of the screen, or if you're on an iPad, it may be under 3 dots somewhere on your screen or more, but you can put your questions in the Q&A and I'll read them. Thanks, Molly.
Sure. So all of you have talked about healthcare from different perspectives. And when we talk about access in this broad discussion over these many weeks, it's thought of broadly. So it's thought of as not just your primary care physician or specialist that you might see, but it might be your labs. It might be the people who provide you with assistive tech as part of your medical needs. It might be the folks who fit your wheelchair, or it may be even a pharmacist that is very helpful to you. It's often engaging with not just the doctors in the office, but the receptionist, the nurse, the person you have to get through to actually get the appointment, people you really have to make friends with. And so I wonder if all of you could comment for a bit about maybe one or two of those providers that really stand out to you and what made them people that you really felt were able to work with you. What was it? Was it their training? Was it their personal experiences? What was it? And if you didn't have any, then you can just say that. But I'm going to go right back down the line. Oh, I see Marianne's got her hand up. Go ahead.
If you were going to go back down the line.
No, I was hoping you would just put your hands up, but since that's
okay.
good.
So I recently had full knee replacement surgery, had 5 surgeries on my leg because every organ system is dying on me, and including my bones. And I had over 100 fractures on my left leg, and they did a full knee replacement, and they removed part of my bones too and replaced it with rods. And during that surgery, I was extremely scared because I get blood clots everywhere. I have sticky blood syndrome. And how are they going to do this? This is going to be a first in the state of Connecticut. So my team of doctors is fantastic. And it took me 10 years to get this team of doctors. I had a cardiologist, my hematologist, my primary care doctor, my orthopedic surgeon, all working together to make sure that I was going to survive this surgery, because they were going to do the surgery while I was still on blood thinners. I did not have to stop them. And everyone knows that if you're on aspirin or any kind of blood thinners, you have to stop your medicine 3 days before any surgery. And they kept me on it. The day after my surgery, I was still at the Hartford Bone and Joint, and the priest came in to give me my last rites because they didn't think I was going to make it. All my systems were failing on that time, but it was January 27th, 2022 of my surgery, and January 28th, we had a snowstorm, and my doctors all slept in the hospital, and they didn't leave my side. So there are good doctors in the state of Connecticut, and I'm alive because of them, because they didn't leave and they didn't hand me off to a training doctor who would be confused about what APS is. They didn't leave because they wanted to make sure that I was alive. They like to show me off. Every time I walk into their office, they call every trainee they have, you need to meet her. Wait till you see her blood under the slide. It is weird. That's what they call my blood when they look at it. But I'm here because there are good doctors in the state of Connecticut, and I have a great team. And I always say one thing, your insurance card is your money. If someone isn't treating you right, go somewhere else. You don't need to stay with that doctor and until you find the team that's right for you.
It's that partners talking again. So yes, it sounds to me like you had a team of people that were really engaged. And is this something that they normally do, or did they all come together because they were also interested in your illness? Like, what was it? What was
They
it? Do you
do
think
not normally do this. It's kind of great that my hematologist and my orthopedic doctor now play golf together. It's great that if I go to for blood work and then I go see my orthopedic doctor, he's like, I know you went for blood work. And they talk to each other. And so they created a medical experience for me. So when I go to any of my doctors, I don't even have to tell my other doctor what happened. They all know because they're just all close knit. I think that that's how medicine should be. The healthcare issue and the insurance issue, that's one thing. But having a good doctor, that just makes things so much better, so much easier when you're living a life that they tell you you have 80% chance of not waking up tomorrow. So, but if I do wake up tomorrow, I know that I have really great care in my doctors and my physicians.
Donna, you had a comment. See your hand up. Donna,
Sorry.
it's okay.
There we go. Technology. So I have to agree 100% that when Marian was just saying, find a doctor that works for you. I started off this journey as a parent of a child with special needs, knowing nothing. I was just so clueless, and I trusted everybody. Anybody who said they were a professional, I was like, oh, thank goodness, tell me what to do. So live and learn. And my first lesson truly was when I was trying desperately to get a diagnosis. And I kept going back to our physician, and honestly, at one point, he literally patted me on my head. And I just didn't know what else to do. And then I went to see my OBGYN because I was pregnant with our younger, and my legs were bruised, like all black and blue, because that's what my little one used to do back in the day. And they thought my husband was abusing me. And so cleared that up. But they were sort of perplexed by this concept that a 2.5, 3-year-old would be doing this. And they said, well, did you talk to your doctor? I said, yep, here's what they said. And before I left, they had made me an appointment with somebody else, with a pediatric person that they said would be much more appropriate and had experience with, I think they called it complicated situations or something like that. So I was like, okay. And thank goodness, because it was a world of difference. And I landed in a place where they truly had understanding and empathy, and they told me about birth to 3, and it was just a whole different experience. And as time went on, then she was eventually had to switch to an adult doctor, even though, again, the kindest of people who kept us like way past our pediatric time, but finally said, shoo, we have to get rid of you. I'm so sorry. But so we did, and we found a lovely practice. But within that practice, I noticed that there was one physician who really seemed to get her. And it was a surprise to me. I always thought I'd go for a woman doctor for my female daughter, but it was a male doctor, and they connected and he got it. And I'm just so grateful to those people who take the time to learn, and they ask me questions, and then they try and talk to my daughter, whether or not she answers or answers appropriately or answers at all. But every single time he'll still talk directly to her. And then like he'll say, oh, does your hand hurt? Yes. Does your foot hurt? Yes. Does your nose hurt? So he knows he's not getting an answer, but he'll still keep asking. And then he'll say, Mom, anything you want to add? And then we have a conversation. So I so believe that finding those people who are willing to go the extra mile, those are the people to go to, and you will find them. They are there, right? They are there.
Thank you. Yes, you will find them. It sometimes just takes a little bit of work to do it. I went
Yes.
through the same thing. You just have to keep going.
Yeah.
Darlene, I see your hand up, and then Sandy.
Yeah, and I just want to say, Mary Ann, oh my gosh, you're going through quite a bit. But I can tell you're doing what we do, what it seems like Donna does also. It's your personality that's really getting this team to be rooting for you and surrounding you with their expertise and calling on whoever they need to call on to take care of you. So good for you. I think you're really a big part of, the success of their treatments. So that's a good thing. And we try to do that also. We try to really bring in a whole team when we bring him in for these appointments to show, this is a big deal. This is a big family. We really need, people to pay attention and spend some time trying to understand him. And same thing as Donna, we've had the same pediatrician who said right now, they're not kicking us out yet. We've recently had to switch dentists because it was a pediatric dentist, and we were terrified. And we brought presents with us. We brought presents for the new dentist, just to kind of be like, please put in the time. We're really begging here. And we were we just lucked out. We really have met some great people who give us a full hour and a half for a cleaning and that type of time commitment. So we really appreciate that. So you find your tribe, I guess, and really try to appreciate it. I also have a cheat sheet that I bring with me about my son. So no matter where we go, here's the history of the medications and all the medical issues, and it's just in one piece of paper. So they can just have it at a glance, and everybody is on board with the exact same thing.
Good tips. Very good tips. Thank you. Sandy.
Yes, I wanted to talk about, I had a gynecologist, Dr. Anna Tirado. She was excellent. She volunteered once a month. She would go to Gaylord Hospital, and she had special equipment that she could examine women with physical. She really took her time. She would sit and listen to you. She would actually block out like an hour, hour and a half each patient, so that she could make sure she was fully listening to the patient. She was engaged. And it was just such a wonderful experience to have her. And I'm very, very sad that she's retired because I would love to still be able to go to her. And I just want to mention too, I had an excellent doctor as a child who actually ended up going to Yale orthopedic. He was still doing it as a pediatric, but he did see me still a few times as an adult, until he finally said, I'm a pediatric doctor. He's like, I really can't keep working with you. But I would say in my mind, those two really stick out for me.
Thank you. So you've all identified this willingness for time, extra time in the office, perhaps extra time in just thinking things through and planning out a treatment. And you've also talked about the amount of time that you all put in making some of that happen. So I guess my question to you, and you may not be able to answer this, but I'm just going to sort of throw it out there. If you were someone who had your own communication challenges, perhaps you don't speak English, perhaps the medical world is a little intimidating to begin with, and you were raised in a culture where you don't challenge the doctor. What would you recommend as a support to that person to navigate through this very complicated maze of getting good care when you have a disability? What could you do? If you think about your own experiences. I see hands up from Darlene and Mary Ann and Donna. Oh, Mary Ann went away. Oh, there you are. I'm sorry, my screen bumps. Go ahead, Mary Ann.
Other parents have been definitely where I found out any information. And I think that if I didn't, know, is this the right thing? This is what the doctor told me. This sounds a little sus. I think it's just a network of other parents and talking to other people who have gone through similar experiences that really give you the inside scoop on, stay away from this person, go to this person. This person has a tolerance for people with disabilities. This one has 0.
Yeah, thank you. Thank you. Mary Ann?
Absolutely. You have to have, it takes a community to raise a child. It takes a community to have good health care. And even people who don't speak English, who speak Spanish, who are deaf and hard of hearing, who speak a different language, you have to be able to word of mouth. Is this a good doctor? Go online, read in your own language, reviews on doctors, if they're good or not. When I woke up from my knee surgery on January 27th, I was having an asthma attack from the anesthesia, and I was intubated, and I was scared, and I was in pain, and I didn't know how to tell the nurse I was in pain. So I speak English, Spanish, and ASL, and I signed, "I am in pain." And the nurse looked at my file and said, "My patient is deaf? My patient is deaf?" It took 20 minutes for the Hartford Bone and Joint nurse to get an ASL interpreter to me. And I told him, "I am not deaf. I'm just in pain. I'm just letting you know I'm okay. I'm still alive." But she was really, really nervous. It was refreshing to know that they had ASL interpreters in Hartford ready for their patients on a day that they didn't even know if I was deaf or not when I came out of surgery. So it was just hearing this question. If a person has a language barrier, if a person has a developmental disability, there should be people there to take the time to explain services, to explain, what's going to happen. Because if not, then just go someplace else. And that's my advice. It's just your medical card is your money. Take it somewhere else.
Absolutely. Absolutely. I think what we've heard from all of you on the panel is that when you present with disabilities, with more complex health needs, that flexibility is really the key to all of this. I know it was for my daughter that getting appointments scheduled either at the beginning of the day or the end of the day were kind of the best things, because we weren't sitting in a waiting room full of sick people. Didn't work for her. Just having the ability to have a conversation on the phone in the evening rather than
Molly? Oh,
all
sorry.
of those. Yes, Ellen, go ahead.
We have one question, and I know we don't have too much more time, but I want to get it in. What
Please.
about, this is from Siobhan Morgan, what about age-appropriate medical care, such as preventive screenings?
Anyone want to jump into that? Experience with age-appropriate care as your children get older or as you get older?
So I just want to say this about my brother. He is 41 years old. He is wonderful, but he is not 2, and he is not 6. And when the doctor goes in to do a full physical, they should do a full physical for an adult. They should ask every question of him. If he can answer, great. And if he can't, great. But at least you ask. You should ask him, ask them, hey, are you sexually active? Do you drink or smoke? Because there are people with disabilities who like to go out with their friends and do drink and smoke, and maybe their parents don't know, and maybe someone else doesn't know, but the doctor should know, and they should be able to give that kind of advice. I know countless of people with disabilities that go and get a healthcare screening, and doctors don't ask them these questions, and that's sad, because you're going to miss something if you're not thorough.
So let me ask you, Marianne, when he goes into the exam room, are you with him? Is he alone? And do the doctors communicate directly with him, or do they tend to talk to whoever else is in the room? Because that's always been a complaint.
So
Many of my friends with disabilities get really annoyed with the fact that the doctor comes in and talks to whoever's standing there instead of to them.
absolutely both. So what I do is I wait for my brother to go into the room, and then I say I got a phone call, because I don't want to be there. He's 41. I always tell my brother, if I see you naked, it's against the law, because you know that's incest. And he's like, well, you can't see me naked. So that's just a thing between him and I. But the doctor doesn't know that. And then I leave and I make her communicate with him, because he needs to tell her it hurts here. It doesn't have to be always me. Marianne, does he have pain? I'm like, well, Ralph, do you have pain? He's right there. So I purposely leave, even if it's 5 to 10 minutes, as much as he can take before he gets concerned, and have the doctor have that conversation with him so they can ask those private questions, because he might not want to say something with me. He actually told me once that he had a beer with staff, and I would never know that. He told the doctor, then he's like, oh yeah, I had a beer with staff. Like, okay. So you have to give that time alone too. Doctors have to do an adult screening on adults, and they need to not skim and think that they, just because he has developmental disabilities, oh, that's not possible. He could never smoke a cigarette.
Molly, you have, I know Donna wants to answer, but we also have another question too, just to let you manage the
Okay.
time.
All right. So Donna, if you want to quickly answer, and then we'll try and get that last question in before we run out of time.
Okay, so to the preventative question, having a girl is tricky, and we do have to take her to the OBGYN, and she has to go see him in order to just get the pills that she needs to not get her period, but she won't let him examine her per se. The problem with this is, especially in my family, we have breast cancer. My mom died of breast cancer. My mom's sister died of breast cancer. And amazingly, there was no way for her to get a mammogram. And this has been on my mind for the last 2 years for sure, now that she's in her 30s. And so the doctor said maybe we could try just at least an ultrasound, or I think that's what he said. They don't even make mammogram things that you can do under anesthesia. They don't even have such a thing. So this is terrifying to me. And if anyone ever hears about something we could use, please let me know. But we're going to try a little something just to get some kind of baseline, but it's not the kind of baseline we really need considering our family history. It's very scary.
Thank you. Ellen, the other question? We have 2 minutes.
Lisa Nee wants to say she's so thrilled. Oh dear, we have another. I am so thrilled to hear these success stories. Bravo. I have found more often than not, beggars can't be choosers. Many of the best doctors aren't taking new patients or are very selective. Is there an action to take? And maybe the answer to her question is to stay tuned to the next couple of panels. We are definitely going to address that, to find out, to make recommendations. So there's homework to do. And then Rebecca, I'm not going to even try and do her last name. I have experienced ableism by healthcare colleagues, and I'm working to end those behaviors. May I suggest that we start implementing the question, just like, do you smoke, to ask, do you have a disability? And people with disability have a private document they can show regarding how to best take care for their disability barriers. And that sounds like that. We should put that on the agenda for later.
Correct.
And Siobhan Morgan, a sister, just contacted me. Her brother passed away recently at 35 of testicular cancer, and he was never screened at his physical for this.
Oh,
So just sharing. I think now maybe we should turn to Walt, since we're already at or time. So Walt, if you can come back on your screen, turn your screen back on.
I believe that you have to do it.
Do I?
I'm trying,
Okay.
because, yeah, I cannot start my video because the host has stopped it. But you know what? If you can hear, can everyone hear me?
Yes, we can.
Okay.
There you
Well,
are.
all right. Sorry about that, everyone. Hey, it's been a great hour. I respect everybody's time. Thank you, Ellen, Dr. Bruder, Dr. Lutz, Darlene, Donna, Marianne, and Sandra for everything that you shared. This has been terrific. And I want to thank everyone who attended, and especially the legislators, the state officials, and the healthcare administrators who are on this call, because you're the folks we want to be talking to going forward. As Ellen said, this is about finding, actions to make things better. I hope everybody found this informative. I know I did. Time was limited. We couldn't get to everybody's questions, but we're not done. We have 4 more sessions scheduled. In a couple weeks, we're going to have some speakers talk about the difficulties people of color and people in marginalized ethnic communities have in accessing healthcare. That's certainly complicated when you're a person with disabilities as well. Then we're going to have a session with some folks from other states, notably Maine, New Jersey, and Colorado, talk about some interesting things, promising things that they're doing that actually address some of the issues that were brought up here in terms of getting the right information to doctors and tools that families can bring to the doctor to give them some cues on what to do. So again, in 2 weeks, marginalized communities. In 4 weeks, we're going to have the other states. Then in November, we're going to have some folks here in Connecticut who are doing some promising things. So there'll be a whole session just on promising practices in Connecticut. And at the end of November, we'll wrap it up with a policymaker roundtable to talk about what do we do, as someone asked. What are the actions we can take? So again, I want to thank everybody for being here. If you attended this, you'll be receiving an invitation to our future events. And of course, we'll also have this up on our website and elsewhere for others who want to attend future webinars. So with that, again, I thank everybody, and I hope to see you again in our future sessions.
Thank you. And if you could take a moment and fill out the evaluation, you can use the QR code reader on the screen now, or it will come in the follow-up as an attendee. Thank you.
Great.